Hello, YouTube. It's the Overnight Minister's wife, and I'm back with an update. Sorry it's been so long, but I have not been feeling like posting anything, if I can be completely honest. Um, I am 15 days post-op tubal reversal surgery and feeling so much better. I initially thought that 1 week out of work would have been enough, but I actually ended up taking an additional 2 days because I just wasn't feeling up to it. Actually, sorry, fix it. Actually, there was a time during my recovery where I questioned whether or not the right side of my incision had actually opened up or started to open because it just wasn't looking good. The left side was looking nice and neat and clean, and the right side was just looking, wasn't weeping or anything, but it just didn't look as good as the left side. So I was concerned about that. Turns out that I'm healing up nicely. I just think the right side, the way the doctor described it to me was that the right side is kind of healing with an overlap of tissue. So the skin it isn't even or flush on the right side like it is on the left. But other than that, I'm doing okay. My pain on a day-to-day is probably between a 1 and a 2, which is wonderful. Ibuprofen 800 milligrams gives me pain relief and makes me comfortable practically all day. I went to the doctor for the first time on Monday. It was my post-op visit, not with the doctor that did my surgery, but if you remember in my previous video, I mentioned that I'd made myself an appointment with an OBGYN doctor at Duke University Medical Center. And his name is Dr. Nieves. That's Angel Nieves. And he was wonderful. I told him about my tubal reversal surgery. I also took, sorry, I got to shift. My arm's getting tired. I'm holding this phone with my hand. I also took my post-op report, my operative report, I'm sorry, and he had all the details of my surgery, so he knew exactly what had happened during my surgery, how much tube I had left on both sides. So after reviewing that, he came into the room and basically wanted to know about my concerns before he got down to whatever it was he had to tell me about what to expect in trying to conceive and what to expect once I do conceive. So I explained my concerns, especially with me already being on a high blood pressure medication. I was already taking HCTZ, 25 milligrams a day, which is a very low dose. But still, that was a concern to me because I know that it's not the favored medication for women that are expecting or women that are pregnant or trying to conceive. So he did switch my blood pressure medication, and today I started labetalol, 100 milligrams. He wants me to try that once a day and see how that goes. I'm going to monitor my blood pressure, see how we do with that. And then if it's not controlling my blood pressure well throughout the day, which I'm sure it will, because 25 milligrams of HCTZ is nothing. And taking 25 milligrams of HCTZ actually had my blood pressure below normal, like 116/78, like 116/76. It would be very, good, but not normal or above normal. It would really have my blood pressure below what doctors prefer it to be. He also told me that due to my age, at the ripe old age of 36, I would have to go on a baby aspirin once I do conceive. He's concerned also about my history of multiple C-sections because this would be a third C-section baby. And he also asked me, once I do conceive, would that be my last baby? And I'm looking at him like, probably not. Like, I didn't have my tubes reversed to do one baby and say, oh, no, we're just going to tie him again. Come on now. And so he was like, well, that would be a fourth C-section. I said, well, let's talk about that when we get to it. Let's just stick to me trying to conceive right now, what to expect, what your recommendations are. And he basically said, you can track your ovulation cycle if you want, or you can just do what you would normally do. He said, did you have difficulty conceiving with your other children? I told him that I didn't. He asked me if my partner was the same from when I had my other children. I said, yes, I've been married for 18 years. He said his reason for asking that was because then they at least have an established fertility with my husband. So we know that my husband is able to actually, you know, make babies. So my AF came on Monday. So today's Wednesday. So 2 days ago, she came for a visit. And my prayer is that before the end of January, and I know this sounds like I'm reaching, I get it. But before the end of January, I would love to have a positive pregnancy test. And I'm sure everyone that's had a tubal reversal surgery has said, oh, I would love to get pregnant within the first few months. So add my name to the list. Um, what other issues did I have? I still have some numbness, and I don't know. I'm going to give it another week or so before I reach out to the doctor. But on the right side, I know I keep having issues with that right side. On the right side, I'm having like numbness, but it's not like regular numbness. It's like almost discomfort numbness. You know how when you hit your funny bone and I don't know why we call it a funny bone, because it hurts. Like it's not a regular pain when you hit your funny bone. It's almost like a nerve pain, almost like a numbing. And that's how I feel on the right side of my pelvis. So much so that it's uncomfortable for my jeans or my pants to rub up against that area. Speaking of jeans, I'm back in jeans. I was not able to wear jeans probably so I took 7 days out of work, wore elastic leggings 2 days. So we're talking 9-10 days before I was able to put on jeans and button them up and not be uncomfortable. My belly was so swollen that jeans that were loose were tight. They were uncomfortable. So yeah, I'm now able to put on jeans, but the jeans that I am wearing have they're stretch jeans. Like I can't wear jeans without stretch in them right now. So still taking ibuprofen, but other than that, I'm very comfortable. What else? Oh, we've baby danced several times before Aunt Flo came on Monday. So no issues with that. No difficulty, no pain, no discomfort with that. I wasn't expecting to get, you know, pregnant by that because, I already know when my ovulation cycle occurs and all that stuff, but just doing it for fun. Um, Anything else? Baby aspirin, blood pressure. That was pretty much it. He basically was saying that the fact that I've had my tubes reversed does not interfere with or affect how safe it would be for me to be pregnant. Like, one has nothing to do with the other. So, biggest concern is, like I've said many, many times, is ectopic pregnancy, making him aware as soon as I have a positive pregnancy test so I can come in and have my hormones checked every 48 hours. And, if it's an ectopic, then we do the methotrexate and keep it pushing. So that's pretty much it. Yeah. And I don't like long videos, and I'm already at like 8 minutes and 25 seconds. So I promise to post another video this weekend because I have some other stuff to share, but I don't like super long videos. That's it. I'll hit you guys back sometime this weekend. Take care.